Hi everyone, welcome to Chapter 12. So I know it's probably a bit unusual that we're skipping chapters, but I like to include Chapter 12 with Chapter 4. I have found that after teaching 3 or 4 semesters of global health, they really tie in nicely together because as we're speaking about socioeconomic factors that influence healthcare and can cause health disparities, we have to really talk about global health payers and players. That really kind of rounds out that discussion. So this one, I'm going to refer to the book quite a bit. The PowerPoint is pretty brief and not very detailed. So going into the core building blocks of health systems, there are 6 factors that need to be included to effectively build a health system. So we have to have the provision of effective personal and population-based healthcare services. We need to have a well-trained and productive health workforce that is able to provide quality care to all populations. We need to have access to essential medications, vaccines, and health technologies. So far, the U.S. is doing pretty good on these 3. A strong health information system that collects data about health systems performance. We also need to have a health financing system that enables everyone to access affordable needed services and at the same time provides incentives not to overuse services. We will come back to number 5. Number 6 is effective oversight of the system to ensure safety, efficiency, and accountability. So as you know, the Affordable Health Care Act was enacted. I was still in graduate school, so it's been within the last 10 years. I would say probably 7 years ago, with the goal to provide coverage to those uninsured individuals. My personal opinion is that it was very good in theory. I think the idea behind it was quite noble. However, it had many flaws. That being said, with the recent election, there are many that are unhappy with the Affordable Care Act and want to change that or repeal it. So as we're talking about this particular chapter, health players and payers, especially within the United States, keep in mind that this is going to be a couple of years of tremendous change with our healthcare system in the United States. I don't know if it's going to be for good or not. That will remain to be seen, but I really want you to kind of keep that in mind as we discuss it, that it's one thing to talk about equal access to healthcare, but it's yet a completely different animal to try to actually provide that. So, moving on, sorry about the soapbox there. Oh, I wanted to go back to, getting ahead of myself there. So, I wanted to go back to number 5 on here. So, a health financing system that enables everyone to access affordable needed services at the same time provides incentives not to overuse services. I would love to hear from you guys. Do you think this is in place currently? I don't think it is. We know that there are many Idahoans, I believe 77,000, that fall into the gap, that can't afford health insurance and yet are being penalized on their taxes based on that inability to afford health insurance. Also, are we providing any sort of incentives not to overuse services? This has to be really enacted, I think, from individuals on up. We're going to talk about more about how our current healthcare system pays, but having worked in medical insurance and in the medical field for over 20 years, I can safely say without reservation that I am not aware of enough incentives to discourage overuse of services. We have people that struggle to get services, and then on the flip side, we have people that use services for every little thing. and may use services on things that can be prevented. One of my key points after working in the medical field for so long is, especially when I lived in Hawaii, there was a huge misuse of emergency rooms. And it was because, and I'm really dating myself here, but this was before the urgent care facilities opened up. So we had regular doctor's offices and we had emergency rooms. Well, if someone's working during the day, they can't go to the doctor when they have what they call a sore stomach. So a lot of individuals would wait till they get off work and then go to the emergency room. Well, obviously, behavior like this is going to drive those costs up. And I think all of us that are currently in the medical field can really see instances in our lives that we've experienced in the healthcare field that may be indicative of some of the rising costs. Just one of many factors. Okay, health systems and paying for public health. So universal health care is a government-sponsored healthcare system that is paid for through a general tax revenue or a government-run social insurance system. This is referred to as a single-payer system. All the monies paid for health are taken from one source, i.e. the government. Now the government may get that money by taxing individuals, or it may be a social insurance program as mentioned, but key point is it is a single payer program. In contrast, the U.S. is a multi-payer system. It is one of the few developed countries without a universal health care plan and is a mix of private, public, and private and public health care systems as well as healthcare providers. So there may be some people that are on Medicare, there are some on Medicaid, there are some through Blue Cross, there are some that have purchased their own insurance, there are some of us that it is paid for primarily through our employers. You can see that it's not, in the US, it's not a one-payer system. It's coming from all different avenues. Many of us, when we think about universal health care, we tend to think of Canada. One of the places, if you have it in your mind that you would like to learn a little bit more about a system that really seems to work, I would invite you to investigate France's healthcare system. They seem to have it all together. Haven't seen the complaints or heard of the typical issues with the universal health care in France that you have heard in other countries. So many of us think that we should be able to provide health care to all. But here is the bottom line question. And this is where it gets so convoluted. And when we start thinking about ethics coming into play, are we willing to pay for it? Are we willing to go to a universal healthcare system in which pretty much the decision to see a provider is taken from us? So I have the luxury now, being insured through Blue Cross of Idaho, that, you know, I have worked in medical. I have enough background to know when I need to see a specific type of doctor. I'll use my thumb surgery, for instance. You know, I could go to my general doctor and exhaust that option and have them refer me to an orthopedic doctor. Having worked in orthopedics for a number of years, I knew, yeah, I'm going to skip the middleman. I'm going to go right to that specialist. So in a universal healthcare system, that kind of freedom is taken away. So when we start thinking about universal healthcare, and I am not for or against, I have no bias here, but I think we really need to dive deeper into the question. A, are we willing to change our lifestyles to go along with that? And B, are we willing as taxpayers to fund such a healthcare plan? I may even throw that in as extra credit for discussion board this week. Kind of wait and see how the discussion's going. So again, so very many facets to this one issue. So we have several global health programs, skipping now into the global aspect out of the U.S. aspect. So we have research and education, we have the clinical services, relief aid, community development, advocacy, logistics. These are some of the many things that are covered within global health programs. We have several United Nations agencies, and I apologize, there is a typo on the page. It should be page 299. So many of us have heard of the World Health Organization. Their primary purpose in the United Nations is to provide and oversee health. We have other entities such as UNICEF. I think all of us have heard of UNICEF. That is the United Nations Children's Fund. Their primary work area is work with children. We also have the World Food Program. Obviously, as it sounds, it oversees hunger. The ILO is the International Labor Organization, which is going to oversee labor. So all of these United Nations agencies have their own specific topic to oversee. We will talk quite a bit about the World Health Organization as we go on, because in global health, obviously so much of what we talk about, many of these disease initiatives, prevention initiatives are going to be based out of the World Health Organization. So this could end up being a pretty controversial discussion board. We're going to be talking about whether healthcare is a right or a privilege, and again, I just ask for you to respect each other's opinion. There is no right or wrong answer in this. Unfortunately, those of you that are very concrete thinkers, I am probably driving you up the wall with the subjective nature of this class. However, health overall is not a black and white issue, especially when you start taking it outside of an individual, and even then, individual, community, national, globally. There simply is no right or wrong, or one black and white. There's so much room for subjectivity, and so much of it really depends on your own ethical compass. So forgive me for my passion for this particular topic, but I love getting into week 4 because I think it's really going to start getting into the guts of what we're going to be talking about on a global level. And of course, we can always relate that global level back to a national level, a community level, and an individual level. You'll see that everything we do, every decision we make for our individual health affects something more than us. It has such far-reaching implications. So I hope you are as excited about this week as I am. Let me know if any questions. You can email me or use the Ask My Instructor link on Blackboard, and I will talk to you all in week 5. Thanks, guys.